This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Hello.
Hi.
I'm
back.
Evie,
I'm Julie.
and this is Funny Medicine. And if you haven't been in our little series, today we're talking about rubella.
Rubella.
Yes,
That's another
rubella.
one.
That's another one. That's another. If you checked out our previous episode,
Yeah.
during the AAP conference, they kind of went around asking pediatricians what is a word in medicine that kind of just rolls off the tongue and kind of makes you feel good and expensive. And
Right.
people had a lot of really funny words and medical things to say. And one of them was, well, the one that we were talking about was paramyxo, or no, it was
The one with an R.
rubavira. I don't know.
I don't know, but it was another one. And I'm like,
This one's another one, rubella.
What are you wearing? Wearing
Rubella. I don't ever want to wear rubella.
Or like a pretty girl.
I'm like, I don't ever want to wear
No,
rubella.
I know. But like, or a pretty girl name. Like, hi, Rubella. My name is Rubella.
I could totally see that.
Ella.
Yeah. Ella. Yeah, short name Ella.
That's totally a girl name.
Can you imagine? She's like, she's got the Ella. She's got Ella.
It's going to be a good episode.
Like the clap. She's got the Ella.
Exactly.
Okay, well, I never hope.
No.
I hope that no one ever has.
Absolutely not.
Ella.
And this is why we'll get into that.
Yes.
Trigger warning for this episode. There is going to be mention of miscarriage and birth defects, pregnancy, things of that nature for this episode and the topics that we'll be talking about, because unfortunately it's part of rubella.
Congenital rubella, yeah. All right, so talking about rubella and the history, what it is, where it come from.
All the things.
All the things. Now, rubella is a contagious viral infection best known for its red rash. It's actually very similar to that measles rash, and it's often nicknamed German measles, but it's not the same as measles, and it's caused by a different virus entirely. In fact, the name German measles comes from the German physician who first recognized rubella as a distinct illness back in the 18th and 19th centuries. The term rubella itself is Latin for little and red, and it's coined in 1866 by an English doctor describing its characteristic rash. So for most people, especially children, rubella is a mild and even a symptom-free virus, and many infected individuals don't even realize they have it. However, rubella's real danger is during pregnancy and the results that can happen after that if you are pregnant and have an infection with rubella. Now, if a pregnant person catches rubella, it can cause devastating birth defects in unborn babies. It's one of the torch infections. So torch is kind of like just an acronym that we have for different types of infections during pregnancy that can have certain outcomes in the baby, and rubella is part of them. Now,
Scary stuff.
it is.
I didn't know. Again, this is like mumps.
Really?
For me,
Yeah.
that I didn't know too much about it, because it's one of those illnesses that like you don't see around thanks to vaccinations.
Yeah, thanks to
now in
vaccinations,
our
yeah.
generation at least.
Yeah.
And when I started looking into this, I'm like,
No, it's actually pretty
wow.
devastating.
Yeah, it's horrible.
So thanks to widespread vaccination, rubella has become very rare in countries like the US, but still circulates in some parts of the world where vaccine coverage is low. And in this episode segment, we're going to break down rubella's history, causes, symptoms, prevention, and why it remains a health topic of interest today. And it's so crazy to me because there's so many torch infections that, like anyone, right? Not even a doctor, like moms and everyone is like, oh my God, like that's a crazy infection during pregnancy. And we're all like, toxo and all these things.
That's literally the first one that comes to mind.
Yeah, well, there's so many more, like CMV and varicella and all these things. And I'm just like, I don't understand how people don't want that protection. Again, it's like, I don't understand.
It's crazy to me.
But
All right, so history of rubella. Rubella was initially mistaken for a variant of measles or scarlet fever until scientists separated it as its own disease in 1814, a long time ago. German medical reports from that year described it in detail, hence the lasting name German measles. Fast forward to 1941, an Australian ophthalmologist, Norman Gregg, noticed an unusual pattern after a rubella epidemic. Mothers who had rubella early in pregnancy were giving birth to babies with cataracts and other defects. This was the first recognition of congenital rubella syndrome, or CRS, revealing rubella's ability to harm developing babies. A major turning point came with the 1964 to 1965 rubella pandemic in the US. In that outbreak, an estimated 12.5 million Americans caught rubella, and the toll on pregnancies was catastrophic. 11,000 pregnant women miscarried and lost their babies. 2,100 newborns died shortly after birth, and 20,000 babies were born with congenital rubella syndrome, or CRS. This crisis spurred urgent efforts to develop a vaccine. Researchers isolated the rubella virus in 1962, and by 1969, the first rubella vaccine was licensed in the US. A combined measles, mumps, rubella, or as we know it, the MMR vaccine, followed in 1971. The rubella vaccine, notably the RA27/3 strain developed by Dr. Stanley Plotkin, proved highly effective. In the decades after vaccination began, rubella cases plummeted. For example, about 47,000 rubella cases occurred each year in the United States in the pre-vaccine era versus 3 cases reported in 2020.
Again, when numbers just,
hit.
yeah, exactly.
Yeah, they just hit. That's why I love the history portion, because it's like, do you want to repeat that?
Yeah.
Do you want to go back to that back then? Like, I don't.
And again,
I
I'm
don't.
here saying I'm a physician, a pediatrician nowadays, and I have not seen congenital rubella.
And that's a win.
And that's a win.
That's
exactly.
Especially.
I want to keep it that way. I don't want to see it.
Exactly.
Actually.
Exactly. By 2004, rubella was declared eliminated in the United States, meaning no continuous year-round transmission. Elimination, for just to delineate what each of these words actually means. Elimination doesn't mean 0 cases ever, but any cases arise from travelers and don't lead to sustained outbreaks. That's what it means in a technical medical sense in this case. In 2015, the entire region of the Americas was certified rubella free by the World Health Organization, and that's a huge public health victory. I mean, all of the Americas. We're talking about Canada, North America, Central America, South America. Incredible.
Those numbers, how much more evidence do you want than that?
Exactly.
For something so severe, yeah, maybe not when you're pregnant, but if I could reduce that risk of spreading it to someone that is pregnant, give me the shot.
Exactly.
Give it to me.
Exactly.
You know? It's like what we said before in our previous episodes. In order for public health to work, the public needs to participate.
Exactly.
So yeah, that means I'm taking a shot to prevent maybe someone else from a devastating miscarriage or a congenital malformations, blindness in a newborn. Yeah, give me the damn shot.
You know what I don't understand? The environment of pro-life people and anti-vaxxers and this whole climate of this particular group of people that they have those common interests, right?
Yeah.
And then they want to promote more people getting pregnant, having more babies and all this. And I'm like, do you see that there are discrepancies there? There are things that...
There are things that would maybe stop someone from wanting that. Yeah.
Or getting pregnant or having a viable pregnancy or having an actual, having a baby. It's like, how does that... Do you not see the conflict there?
Yeah.
I don't understand. It just...
Because
it's
remember,
another
they don't
thing.
look at it through an actual procreative way. They're looking at it as more of like how to sustain our population.
Like, how can we?
But how can we? Exactly. Because they're looking at more as like a numbers type of thing.
Yeah.
If you look at the news, they're always talking about like 22%, this percentage and this percentage and this percentage of this and this and that. And it's like, well, yeah, but can you explain why that happens? And they don't touch on the why. right? They don't talk about how expensive it is to have a kid. They don't talk about how expensive healthcare is. They don't talk about the immunizations and stopping vaccines and all these things, so the potential for kids to get really sick. So yeah, I understand. Like, I'm the first person, I've had a kid before, and I understand like how happy I was during pregnancy. And but again, that doesn't mean that fear does not exist, and I wouldn't be able to blame anyone from not wanting to have a child because of this. Or to be honest, if you don't want a kid, you don't want a kid, point blank. Like, no one can force you to do that,
Yeah.
you
Yeah.
know. But yeah, it's just
There's
we can
so
go on a
much-
whole entire
There's a
other
conflict,
tangent.
but it's like this one here is
But
a
this-
vaccine
yeah.
that would prevent from women miscarrying.
Yeah.
And you're against vaccines? Like, how does that fit the logic that you're saying that
Yeah.
you are pro-life?
Or it's at least
and-
reducing the risk of you getting an infection that could potentially lead to a miscarriage. 100%.
Exactly.
I get what you mean.
You see what I mean? It's like that. It just goes right against everything that you're saying. But
Yeah.
okay, sure.
Yeah. Rubella is caused by the rubella virus, and it's a single-stranded RNA virus. The genus is rubivirus, and that infects only humans. It spreads in a similar fashion to many other respiratory viruses through airborne droplets and when an infected person coughs or sneezes. You can catch rubella by breathing in these droplets or by direct contact with the infected person's nose or throat or mucus. Rubella is not as crazily contagious as when we've talked about measles or maybe varicella, but it does spread rapidly in unvaccinated groups. And this is something like a real world example. Let's just say a pregnant person that has kids, right? And you decide that you don't want vaccinations for your child, right? You keep on having kids. So you can be pregnant any single time that your kid comes home
Yeah.
with a fever and a runny nose.
You're risking it.
You're risking it, right?
Yep.
And that's a very real world situation that many people exist in.
100%.
But again, they haven't seen congenital rubella, so they're not
true.
really scared of it, right?
Yeah, you're right.
But again, not like that crazy time in the United States where they had multiple cases of women miscarrying, multiple cases of kids with congenital defects. But again, one tricky aspect is that people with rubella become contagious in about a week before their rash even appears, and they can continue spreading the virus for about a week after the rash erupts. So moreover, 25 to 50% of infected people have no symptoms at all. So in other words, someone can unknowingly transmit the rubella virus around their community and not have any symptoms. This is a stealthy, contagious period, and it's with big reason that rubella could circulate widely before vaccination was common.
Yeah.
Now, rubella occurs worldwide, but thanks to vaccines, it's no longer constantly circulating in the US. However, it can be reintroduced when the unvaccinated travelers bring it from abroad, or in certain communities where there's unvaccinated groups of unvaccinated communities, and that could also circulate within there. Importantly, if a pregnant person catches rubella, the virus can cross the placenta to the fetus, and this is the route that leads to the congenital rubella syndrome, and we're going to touch on that a little bit more. Rubella is often very mild, and in fact, it's noted up to half of the infections show no symptoms at all, like we've said before. Now, when the symptoms do occur, they usually appear 2 to 3 weeks after exposure to the virus. Now, here are some of the typical symptoms that you can see and how it differs between age groups. Children, young kids usually get some of that rash, the red, pink rash for the first, it's like the first sign. And then the rash often starts on the face and goes down, which is very different from measles, which is usually starts on the trunk, goes up to the face. Actually, no, I think measles is also from the face down. Rubiola is the one that's from the chest up, which is roseola. Yeah, roseola.
I hadn't heard of that one.
The one that's like fever, and then when it stops having fever, they like erupt in a rash.
No, I honestly had not heard of that
Roseola,
one.
really?
Yeah.
Yeah, it's like it's very confused with German measles because of like the typical rash. But anyways, the rash often starts on the face and then spreads down towards the trunk and the limbs, and it's a fine kind of like spotty rash, sometimes called like a 3 days measles because the symptoms are very similar. Kids might also have fever and swollen lymph nodes, especially behind the ears or at the back of the neck, posterior lymphadenopathy. Now, overall, the children usually handle rubella very well, and kind of recover quickly. Now, adults, in teens and adults, rubella can start within a day or two of mild fever, headaches, runny nose, tiredness, kind of like those flu-like symptoms that we always talk about. And then the rash in adults is a similar one and still generally fades within a few days. Now, adults, especially women, are more likely to experience joint pain as a rubella symptom. Up to 70% of women with rubella get arthritis or arthralgias in the fingers, wrists, knees, and these joint symptoms usually last a week or two. Adult men and kids rarely have these symptoms. It's just interesting that just that change in gender can cause some more symptoms. The illness is usually mild and self-limited. After a couple weeks, you kind of recover fully, but because it's so mild, it can be really hard to notice and pick up. That's why we say it's like very like stealthy in that sense. And again, the rash can kind of disappear within days, so you might not even know you had that, right? How many times do you get a virus and you're like, oh, what is this? And then by the next day, you're like, oh, it's gone, whatever.
Yeah, seriously, like all the time.
You don't go checked. You don't go
Absolutely.
get checked. The mild nature is a blessing for the actual person that's infected, but it does contribute to the rubella's spread historically when people didn't realize that they were sick.
All right, so talking about the scary stuff, unfortunately, now.
Yeah.
So the complications and the consequences, unfortunately. In non-pregnant individuals, true complications from rubella are uncommon, but they can happen. So for example, rubella can inflame the brain, aka encephalitis, in roughly 1 in 6,000 cases, causing headaches, seizures, or altered consciousness. It can also lead to bleeding disorder called thrombocytopenic purpura. Penic.
Yes.
Thrombocytopenic purpura.
Yes.
Ha!
You didn't even have one of those things.
I didn't.
Yeah.
I'm like,
That was all natural.
I'm going for it. I did it.
You
Anyway,
did it.
watch me fuck it up. It's something very, very easy.
Watch me
now.
fuck it up real
Yeah,
soon.
it's like now. Anyway, that's low platelets, which then would cause bruising or bleeding and things like that. And that would be in about 1 in 3,000 cases. These complications are rare, but they remind us that rubella isn't always just like trivial and nothing to worry about. Other reported issues include testicular pain in males or neuritis, which is that nerve inflammation. But these are not, again, common. Most people simply don't get very sick from rubella itself. The real danger of rubella is its effect on pregnancy. If a woman becomes infected with rubella in early pregnancy, especially the first trimester, the virus can disrupt the development of the fetus. The result may be miscarriage, stillbirth, or a baby born with congenital rubella syndrome or CRS. In fact, rubella is the leading vaccine preventable cause of birth defects worldwide. An estimated 100,000 infants are born with CRS each year around the globe. The risk is highest if infection occurs in the first 12 weeks of pregnancy. One large review found up to 85% of infants will have CRS if the mother had rubella in the first trimester. Later in pregnancy, the risk of CRS is lower, but still significant. Babies with CRS can suffer a constellation of issues, all right? Commonly deafness, cataracts, which is eye damage, and heart defects. Hearing loss is the most frequent single defect. Rubella during pregnancy used to be the #1 cause of congenital deafness. Heart defects such as patent ductus arteriosus,
arteriosus. Yeah,
arteriosus. I tried, but even so, you see, I know
you got it at the end.
I know I was going to fuck it up. And vision problems. Clouded corneas or cataracts are also classic. But CRS can affect almost every organ. It often causes intellectual disabilities, growth delays, liver or spleen damage, and bone marrow problems. Some CRS babies have a distinctive quote-unquote blueberry muffin appearance at birth due to skin spots. And that's a sign of impaired blood cell production, which leads me to believe leads me to think like this whole thing with RFK of like how he's so like gung-ho about this mitochondrial disorder situation that he could see kids with what he deems disorders. So it's like, don't you want to inhibit something that we know can cause intellectual disabilities, can cause a slew of issues for children?
Mija, tú no entiendes que ese hombre está enfermo.
He has to be,
Like-
because I'm like, this is proven to prevent that.
Yeah.
To prevent what you are like marketing so hard.
Did you not see the
you
most
know?
recent video that he came out with?
No, it
With the
cringes
Halloween
me.
one?
It
I'm gonna
cringes me
send it
to
to you.
watch that man.
I'm gonna send it to you.
Like him and Trump, like I can't watch them because
They live in
I
another
like,
world. They live in an alternate universe.
but they get vaccines.
Oh, yeah,
And they
yeah,
get
yeah.
vaccinated,
Yeah,
and now
yeah.
their loved ones get vaccinated.
Yeah.
All right. So tragically, many affected infants passed within the first year of having CRS. Those who survive may require lifelong medical care. For example, cochlear implants for hearing, heart surgeries, etc. It all depends on what it affects. Before rubella vaccines, up to 4 out of every 1,000 babies were born with CRS in some regions. Now, in countries with vaccination, CRS is almost unheard of. For example, in the US, 0 CRS cases were reported in 2023. That's amazing. Yes. You would never want to see an innocent baby have to deal with any of
Nope.
that. So,
Like I said, I don't want to see it.
yeah, nobody would. Like, who in their right mind would want to? So, preventing these birth defects by stopping rubella infections is a major motive behind rubella immunization programs. It's worth noting that rubella infection during pregnancy is the concern. If a woman is vaccinated or had rubella long before pregnancy, there is no risk of CRS to future babies. Immunity protects the fetus. The danger is when a non-immune expected mother, aka an unvaccinated mother, encounters the virus as she's pregnant.
Yeah.
So,
Yeah. And also, I just want to say there's so many women that do not know that they're pregnant
oh yeah, especially within the first 12 weeks.
within the first 12 weeks. Many women do not know that they're pregnant.
And
so
tests
sometimes
don't
they're
even
not.
tests, I think, is the earliest is 6 weeks, maybe. I think it's up to 12. No, not even. Like the early.
When I was pregnant, they didn't even give me my first appointment until I was 12 weeks.
That's what I'm saying.
And I remember being like, that's like already the first trimester.
But I'm saying like the over the counter, like pee on the stick.
Yeah.
I think the soonest that you could detect
It's like
pregnancy,
maybe like 6 weeks.
like
yeah.
6 weeks.
4 to 6 weeks, maybe. This just depends like on how high your HCG and your urine
Exactly.
is.
But like 12 weeks is nothing, is what I'm trying to say. Like you may
No,
not
even
know
if you have an
pregnant-
ultrasound,
Yeah.
you won't be able to pick it up so early.
Right.
Yeah.
So it's like you may not know.
Yeah.
These women may not know at all. It's just like
So they may not be as careful or something
Exactly.
if someone's around them is sick or something like that, right? Like
Yeah.
they might not know.
and again, they may not even have symptoms.
Yeah. Exactly. Yeah. I mean,
So-
who knows, right? So jumping into treatment and cure, unfortunately, there is no antiviral treatment that exists to date for rubella. But the good news is that one usually isn't really needed. Rubella infections are typically, again, really self-limiting, meaning the body kind of clears the virus on its own and supportive care is going to be the mainstay. Now, this includes rest, fluids, medications like Tylenol or acetaminophen to reduce the fevers and even some of the discomfort associated with it. Because rubella is caused by that virus, antibiotics won't help. It's something targeting a superimposed bacterial infection, but they're
again, guys, antibiotics do
It's not for
work
viruses.
for viruses.
Yeah.
It's specifically for.
Yeah.
I know it's common that you're sick and you're like, give me the antibiotic. No, it's not gonna do anything good.
Yeah. And most of the time, you just need time. But again, rubella is not a common enough illness these days to kind of have a dedicated antiviral therapy, even if it did exist. So for most patients, home supportive care is more than enough. Staying in bed if you feel unwell, use fever reducers, isolate from others, hydrate, hydrate, hydrate. The illnesses generally are mild, over within a week. But again, one important caveat is pregnant women who are exposed or infected and need close medical supervision. There is no treatment to prevent CRS. Once rubella infection occurs, unfortunately,
There's no treatment.
There's no treatment. In certain cases, an injection of antibodies, an immunoglobulin, might be given to pregnant women to kind of combat that. But again, it does not reliably prevent any fetal infection. It is important to help mothers' symptoms, but prevention of rubella is through vaccination before pregnancy, and it is absolutely critical. Preventing rubella is straightforward in theory. Vaccinate everyone before the virus can even reach them. The rubella vaccine is one of the triumphs of modern medicine, and it's a live attenuated vaccine. Again, we would not give that vaccine to a pregnant woman. You should get it before that. And that induces long-lasting immunity in over 95% of people after a single dose.
One dose.
In practice, the rubella vaccine is administered as part of the MMR vaccine, so the combination shot. It protects against measles, mumps, and rubella. Now, I can't, every time I say the combination, I think of Trump, that he couldn't remember the third one. Now,
That's Jesus.
can we just like insert that video really quick? Just
Yeah.
let it play for
We'll
like
put it right here.
Mumps, measles, and all the three should be taken separately.
it's so funny, Julie.
So he forgot what R was for rubella.
Every single time I read the measles, mumps, rubella, I always think of Trump saying all three of them.
So he
All three of
forgot
them.
rubella.
Yeah. But it's just, it's really funny. Like, you're giving advice
I
on
know,
something,
I
and
know,
he's
I
like,
know.
this is based off what I feel. He literally says that, based off what I feel. And I'm like, you can't even name the third one in that series that you're saying to break it up. Like, what? But anyways,
Lovely.
now the MMRV vaccine protects against measles, mumps, rubella, and varicella. That is the combined one. Now, in the US, the CDC recommends 2 doses of MMR for all children. The first at 12 to 15 months old, and then the second between 4 to 6 years old. This 2-dose schedule ensures greater than 97% of recipients are protected against rubella for life. Adults who missed these shots should also get vaccinated, especially women of childbearing age who are not yet immune, which is what we said. You should get the shot before you plan on getting pregnant. Now, in fact, doctors often screen women for rubella immunity via the blood tests during prenatal care or pregnancy checkups. And again, that should be before,
Yeah.
right?
Yeah.
Because the reason why doctors screen during this while you're pregnant, right? The MMR vaccine, we're not going to give it to you while you're pregnant because it's a live virus.
Right.
Really, the screening, if you want to protect the pregnant mother, it should be before they get even pregnant.
I
But
remember when I was planning on getting pregnant and I went to my OB, I had a slew of
Yeah.
things, including titers.
yes,
So that's where I'm thinking that this would
this is
chime
going in. Yeah.
exactly.
Now, during prenatal visits, it's actually to protect the baby.
Exactly.
Because again, they can't get that vaccine until later on. You're trying to protect them. But again, if you want to protect a pregnant mother, it should be before. So like as Julie did, she went to her doctor, made sure that she kind of had everything before
Yeah.
kind of prepping, but again,
Not
a
everybody
lot of
can
them
do
can
that.
do that. Yeah.
Or not a lot of moms are expecting to do that.
That's what I'm
Sometimes
saying, but you don't
get
know.
pregnant.
Yeah.
Exactly.
Now, if you're not immune, you will be advised to get the MMR vaccine at least a month before becoming pregnant. And again, the reason why is because it's a live virus. It's a live vaccine. By making sure moms to be are immune, we are in a way protective. We're kind of forming a protective shield around these babies. Now, the rubella vaccine is very safe. Most people have no side effects beyond maybe a sore right arm or slight fever again.
Yeah.
But a few might get maybe temporary joint aches. This is more common with women who were not immune before, occurring in a small fraction of vaccine recipients. Now, serious reactions are exceedingly rare. One persistent myth deserves mention: the MMR vaccine and autism. Again, we talked about it during measles. We talked about it during mumps. We talked about it now, or we're talking about it even just in our autism episodes.
Check out our
Yes.
measles episodes 1 and 2. If this is the first time that you're tuning into our episodes and you're just meeting us now, we did make episodes dedicated to this. And it was so dedicated to this and dedicated to the misinformation about the MMR vaccine and the autism and all of that, that we dedicated measles 1, part 1, and part 2 of measles, and autism part 1 and autism part 2. In both of those series, we talked extensively about where did this myth come from? Why was this a myth? Why was it created? Who created it? And we really debunked everything onto like the study, what was wrong with that study, and why was it even redacted from the Lancet and all that stuff. We went into it. So I highly recommend that if you are someone that you're not too sure about what's going on and you would like to learn more about it, tune into those episodes. We really dive into that. And this is what we're talking about here in this misinformation part here in this MMR vaccine. It's about that.
Yeah.
It's a lot of misinformation. Check that out. It was, in the long and the short of it, it was a quote unquote study. Can't really I feel wrong.
Which was
calling it
redacted.
I feel wrong calling it a study.
No, yeah, it was a fake study. It was a fake study.
It was completely fabricated, okay, by some guy. He had his license removed and the study was redacted. It was all manufactured and who was paid for it. Go check out those episodes where we dive more into it. But that's the long and the short of it.
Again, This started years ago, and now a discredited study raised concern, like Julie said, about the MMR causing autism. We're
It
not
just
even gonna get into
doesn't,
it.
it just
It's
doesn't
we
die.
have so many episodes. But you know what? I'm gonna say it just in case this is your first episode. So extensive research from the CDC, American Academy of Pediatrics, many
abroad.
others, and abroad and internationally have shown no credible link between MMR vaccine and autism.
Check
Now,
out those episodes for more
all
information.
of them. Unfortunately, the myth caused some parents to delay or refuse vaccines, leading to a drop in vaccinations in the late 1990s and 2000s. It's important for public trust to state clearly that vaccination against rubella is safe and that it prevents devastating birth defects, a huge net positive for society. Aside from vaccination, general hygiene and isolation help prevent rubella spread as well. So we're not just talking always about vaccination. Like we're always talking about, hey, isolation, if you feel sick, don't
Yeah.
go out. You just never know what you're going to have, right?
Right.
Now, good hand washing and covering cough, sneezes can reduce transmission of respiratory viruses like rubella. So if someone is diagnosed with rubella, they should stay home and avoid contact with others, especially pregnant women. And everyone, don't get anyone sick, right?
Yeah.
Now, schools or daycare centers should be alerted if a child has rubella, that pregnant staff or parents can be informed. These measures combined with high vaccination rates keep rubella at bay.
Yeah. So talking about rubella's prevalence and all of this elimination effort that thankfully to vaccines we've been able to keep it at bay, but hopefully it stays like that.
Sorry, that doesn't mean anything, right? Like the
No, it's
uploading.
been like that. Don't worry
Okay.
about it. Yeah, it's just descripting. Anyway, talking about all of that. How common is it even today? That depends on where you live. In the United States, rubella has become extremely rare thanks to vaccines. Fewer than 10 cases per year are typically reported nationwide now. And in many recent years, it's been just a handful of isolated cases. Most of these are linked to travel, for instance, and other things, but mostly travel,
Yeah.
realistically. Americans or visitors who caught rubella abroad and were diagnosed here are that example of those traveling abroad. There is no continuous circulation of rubella in the US, which is why health officials declared it eliminated in 2004. Similarly, Canada and much of the Americas have zero homegrown rubella cases in a normal year. Any cases are typically imported. Globally, rubella is a work in progress. The introduction of the rubella vaccine in national immunization programs has steadily been increasing. As of January 2024, 175 out of 194 countries include rubella vaccination as part of routine childhood shots. Global coverage is about 69%, which is good, but leaves many unvaccinated pockets. The impact of expanding vaccination is clear. Reported rubella cases worldwide plummeted by 97% from about 670,000 cases in the year 2000 to about 17,865 cases in 2022. That's a huge drop in virus circulation. And as rubella cases fell, so did the cases of CRS, which are the birth defects that come with it.
And if you think about it, it's probably the numbers are even more than that.
This is only the reported.
This is only the reported. And remember, we said that like rubella is like technically like very silent. And if you have it, they're mild symptoms. Let's just say if someone came to me, right, no rash or anything like that, then I would feel like, oh, maybe we should test for rubella. But let's just say fever, the coryza, maybe a little rash, maybe not something so
Flu-like
crazy.
symptoms.
Yeah, I'm not gonna jump on being like, let's test you, let's do blood work and all these things. No, it's kind of just like, hey, it's a viral exanthem. Let's watch, kind of like do my whole entire spiel on supportive care and all these things. But so I can't imagine like the numbers of like actual real cases. Like those numbers have to be way more significant.
Absolutely. And when she talks about viral exanthem, it's some viruses, many of them,
Their rash, yeah.
causes rashes. I've seen it on my kid. Like most of the time, he's like a lot like me.
It's very common for viruses to cause exanthem. So
He's a lot like me that unfortunately, like when we get like a viral cold that really like hits us hard, we get like a little bit of a rash somewhere. Like it's like for instance, like for him it's like in the lower back. For me, sometimes it's my belly, you know, or under my pits. Like when I got the chikungunya, I had like big time viruses like right under my pits and stuff like that, like random shit like that. But all depends. The viruses do that, unfortunately. Anyway, several regions have set elimination goals. The Americas were the first to succeed, declared rubella free in 2015. The European region, Western Pacific, and others are working towards elimination, although a few setbacks like measles outbreaks and COVID disruptions have delayed those targets. Some notable recent successes: in September 2025, the WHO verified that Japan has eliminated rubella and that all 21 Pacific Island countries have eliminated both measles and rubella. This achievement required high vaccination coverage and vigilance in those countries. Sorry. It shows that with commitment, rubella can be driven out of entire regions. And on the other hand, rubella remains endemic in parts of Africa and Southeast Asia, where vaccination rates are lower. Countries in those regions still report cases and unfortunately continue to see babies with CRS. For example, if only about 60% of the population is vaccinated, rubella can still spread among remaining susceptible people, including women who then catch it in their pregnancy. It's in these areas that the burden of rubella is now concentrated. Public health organizations estimate over 100,000 CRS births each year, mostly in low and middle income countries without full vaccination coverage. That's pretty much those pockets. It's important to note that quote unquote eliminated does not mean eradicated. Eradication is worldwide disappearance, like in smallpox, thankfully. Rubella is not eradicated. The virus is still out there in some communities. Elimination is on a regional or national scale, and that can be fragile. If vaccination rates drop, rubella can come roaring right back. For instance, European countries have had near elimination level low cases, but in 2023, some rubella cases popped up in countries like Poland, Turkey, and Ukraine. And that was like about 345 cases across Europe in 2023, mainly where immunization gaps exist, unfortunately. These numbers are still low, but they remind us that continued vaccination is needed to keep rubella in check.
Yes. All right.
I just felt like I ended that with a
Yeah.
vaccinate.
All right. So, latest news on rubella. Even as we celebrate massive progress against rubella, there are contemporary challenges and newsworthy angles. The vaccine hesitancy is a big one. In recent years, misinformation about vaccines has led to some parents skipping or delaying the MMR shot for their kids. This has caused worrying outbreaks of measles, and it could do the same for rubella. So again, remember, we mostly talk about measles because we see severe symptoms, contagious and everything. But let's not forget mumps, which we covered in our previous episode, and now what we're covering now, which is rubella. The MMR autism myth is one contributor to this hesitancy, despite rigorous studies finding no link. And combating false information and building public trust in vaccines is crucial to prevent rubella's return. During the COVID-19 pandemic, that was also a big impact. The pandemic disrupted routine health services worldwide, including childhood immunization programs. Many countries saw drops in vaccination rates in the years 2020 to 2021 due to lockdowns or healthcare reallocations. Now, the World Health Organization notes that recovering from these setbacks and closing the immunization gaps is urgent to meet the goals of rubella and measles elimination. In other words, the world needs to play catch up on these mixed vaccines like MMR to avoid future surges of rubella. Yeah. Now, the global eradication goals, there's ongoing discussions about whether rubella can be globally eradicated, which means eliminated everywhere. Just imagine that, like totally eliminating something.
Like smallpox.
Yeah, like smallpox. And in 2020, the experts concluded rubella's eradication is technically feasible in the long run since humans are the only host and we have an effective vaccine. The measles and rubella partnership, which is a coalition including the WHO, CDC, UNICEF, etc., is working under a strategic plan to kind of meet that goal, the immunization agenda, by 2030 to strengthen the vaccine coverage and surveillance. No firm date is set for rubella eradication, but many hope that it could follow measles in eventual global disappearance of enough. Okay. But many people hope it could follow measles in eventual global disappearance if enough political will and resources are applied and available.
Unfortunately, we do not have the political will right now.
Not right now.
No, not in this administration.
Not right now. And did you see who they have for Surgeon General?
For Florida.
No. Did you see the Surgeon General for the US
No.
that Trump elected?
No.
She's a wellness influencer.
She got it?
No, the only reason her confirmation was delayed was because she went into labor. They didn't even do her confirmation hearing. But yeah, she is I'm not going to take away her credit. She's a medical doctor because she graduated from medical school, but she did not complete her residency, which, by the way, Surgeon General, you'd think that they would have a lot of experience in preventative healthcare, which is usually like a primary care field. And her residency was in ENT, which is totally a surgical field. And
ENT
she didn't even,
is ear, nose, and throat doctor.
yeah, but
And she didn't even practice it because she didn't go to residency.
no, she didn't do that. So
Awesome.
imagine a person
Awesome.
that went to medical school, fine. You went to, and actually a good one. She went to Stanford,
Cool.
but
No residency.
no, and also like, okay, yeah, just say she graduated from residency. Let's just play devil's advocate here.
Yeah.
She graduated from her residency. It's an ENT. Don't get me wrong, my ENTs are badasses, but it's a surgical field. It's not a primary care field. So she's going to be leading. And oh, and by the way, the reason we don't really know the reason why she left, right? I don't think that can be like,
I'm curious.
Yeah.
What is it?
no, I mean, there's people that have talks about whether she could make it through the program or not, but obviously she would never say that. She probably
Of course not.
will go along the lines of like she didn't believe in that
Yeah,
or whatever.
Something.
But then she even tried to go into functional medicine. She never became board certified functional medicine doctor. And then she stopped that too. And then she went into the wellness world and she owns a company of like continuous glucose monitoring and she sells a lot of supplements. But get this. I tried to see, well, what's the connection? Like, why did Trump elect her out of all the people to be
Wellness,
Surgeon
business,
General?
Supplements.
No,
business.
hold on. So her brother is Casey, which is RFK's like best bud.
Oh, for fuck's sake.
RFK
Are you
Jr.'s best bud.
serious?
So I'm like, well, why didn't they just choose Casey, right? Like if that's like his best bud, right? Well, he has nothing to do with medicine. He's only like, he went to law school and he did more like, he went more into like the political world. But he's probably like, hey, my sister went to medical school and she would be perfect for this job. So I'm positive that it was like RFK Jr.'s like buddy
Of
with
course.
Casey, and he's like, oh, his sister did it.
It was
she will support our mission.
Agenda.
And RFK Jr. was like, you should elect this person, and Trump elected her. Out of all, if you look back in history, all of our surgeon generals, they've been practicing people, nurses, physicians, and even if they didn't have a primary care background,
treated a patient.
they have experience because if I need a leader, right, I want someone that has been in my shoes. She has not. But when people like kind of say like she doesn't have experience for this job, they make it sound like, well, she's going to be the revolution of it.
That's not how it is.
That's not how it works. I mean,
How are you going to put somebody that doesn't have that experience to lead that revolution? She'll fall on her face.
but she's not going to because really, like, let's be real, she's a puppet.
Damn. She's a puppet. It's only because she has a degree to put up there.
To put it for that position.
Exactly. Wow. They probably were golfing one day and they're like, man, we gotta look teeing up. They're
What
like,
are our options? And of
what are our
course,
options?
this
And they're
guy,
like, wait a
her
minute.
brother,
Exactly, that's what
I'm
I'm
sure
saying.
that he had the plan. I'm gonna
yeah.
plant the seed of my
They're like,
sister.
wait a minute, I know someone.
Yeah.
My sister. No way.
And so much so,
God.
she's always like in this wellness world of no, and like believer of my continuous glucose monitoring.
Has
and
she
also
treated patients?
no, she went into ENT, which is a surgical field.
Right.
Right.
And
So
then
yeah,
she
she
didn't-
had patients of ENT, but she never completed her residency. So the most clinical experience that she got was like what? Like maybe a couple weeks during like a medical student, and then maybe 3 years of
What that you know,
residency.
You know what's I'm not a doctor, you are. But it's annoying to see that there are so many people that are more qualified and more capable and have more experience for that job. And yet somebody that has less experience and less qualified for that job got it.
And
That's what's annoying.
And not only that, but she's in the wellness world. Like in this world where misinformation is
that fits their agenda.
rampant. It fits their agenda.
It does.
Thank
It
you.
fits their
It fits,
agenda.
and
Like-
I don't know how people can be so blinded by that. But they don't. Here's the thing. People actually aren't thinking about it. They're just following the crowd, right?
Yeah.
So they're like, oh, if RFK recommended it, it must be good, right?
But my problem with that is like the same with like alt-right Christians or any alt-right, like any religion, name it. Go ahead and fill the blank. You need to question your leaders. A good leader is someone that
Absolutely.
could answer your questions.
No, you absolutely need to. It's like the perfect example that you just said is the Pope.
Exactly.
The Pope has literally said, I don't think that this administration is actually putting God first.
And yet
right?
they're always going up to bat with that. And I'm like,
Yeah.
but we can't even question you.
Yeah.
Like everything you say has to be like,
And not only
I don't
that,
know. I don't know.
but
It's
these
just
people
not
are
right.
just full of lies, right? Like
Yeah.
she was
Oh,
so
yeah.
gun-ho about her supplements and truly believing in them and their mission and all these things. If you are so intertwined with your mission for your continuous glucose monitoring or your supplements, she said that if she was Surgeon General, she would resign from her position. How quick you are to resign from something that you were so passionate about. Why? Because it's the best thing she's going to get.
How does she go from ENT, ear, nose, and throat doctor to glucose monitoring?
That's how the whole entire thing happened. Remember I told you she tried to go into like functional medicine, but she wasn't even board certified in that either. And then she kind of like left that world and then went into like continuous glucose monitoring and supplements. Yeah.
Girl
Girl's
has
very
done some
interesting.
stretches
Yeah.
to make those leaps.
No, stretches and
She's done.
she didn't complete anything. It's like, yeah, she completed medical school. I'll give her that. But did you complete your ENT residency? No. Did you complete your functional medicine route? No. Are you going to complete your continuous glucose monitoring? No, because you said that you were going to resign if you become Surgeon General. So I'm just like, she is a literal puppet.
That is.
I feel bad for her, to be honest.
No, I don't.
Actually, yeah, I don't.
I don't.
feel like
I don't at all.
I think that's like my soft side. You know, I'm like, I feel bad because you're just kind of like, people are like,
I don't at all. As somebody that has no medical degree, no nothing on that, what pisses me off is seeing like people that are actual practicing doctors,
yeah.
okay, out there that are more experienced, more qualified, have done all the things that they set out to do, and yet are more qualified than her and don't have that opportunity to get that role yet. She did because of nepotism.
Yeah.
That is bullshit.
Just like that.
And that's the problem that we have, because that's how misinformation spreads, because there's people that are leading the charge that are not qualified to lead the charge.
And
don't have the
RFK Jr.,
information.
another Nepo baby.
Oh my God, of course. He's a fucking
Yeah.
lawyer.
Yeah.
And he's
Another
the
Nepo
secretary
baby,
of
yeah.
what? He's
Yeah.
the secretary of health and he's a fucking attorney. He was an environmental attorney. Please explain to me how that
Where's the
qualifies.
connection? Yeah.
How does that qualify? No, it's just, anyway, it just doesn't make any sense. But unfortunately, that's how misinformation happens, because people that don't understand what's going on, don't understand how to interpret things, misinterpret things, take things out of context, manipulate things to their agenda, whatever it may be. I don't know. But that's how misinformation brews and keeps going, because unfortunately, experts are not taking the charge.
Yeah.
And not being voiced and not being heard. But people that
No,
aren't
or you're
qualified.
just like electing someone or nominating them. I should say nominating them. But come on, let's be real. Like, you nominated RFK Jr. and he got the position. So you're going to tell me that they're not going to give it to this girl.
I had heard of her months ago, and I was like, I can't believe that she would fucking make it out of all these other people that can
Yeah.
and are more qualified for the job.
Anyways, that was our episode. Go get your shots.
Please go get your shots.
Yeah.
Anyway, so we're here every Tuesday. Go ahead and subscribe, comment, all the things. You could find us on all forms of social media. at Funny Medicine Podcast. And she has her personal one, which is Dr.GPeats, and I am Jules_Kaz. Find us on all forms of social media. And yeah, we'll see you in the next one. Let us know if you have any topic suggestions. We love those and we will prioritize those as
Yes.
well. And yeah, thanks for tuning in.
Bye.